Wow, medicine can be so tiring at times. I'm exhausted. Did I make the right specialty choice? The right career choice? How many more clicks till I'm done for the day? How many more notes do I have to bring home from work again? That huge queue of messages. Am I the only one struggling with all this? If you've thought any of these things, or heard them from your colleagues, please know you are in the right place, and you are not alone. Welcome to the MedEdWell Podcast, where physicians get empowered to take the next step in their wellness, personally, professionally, and financially. I'm your host, Dr. Ryan Stegink, a practicing general pediatrician and online entrepreneur. Again, welcome to the MedEdWell Podcast. Thank you so much for joining me here on this, the first full episode. If you find this valuable, please subscribe, leave us a review, and share with another physician or student today. Today, we will talk a little bit about my story, my struggles in pursuing wellness for myself, and dealing with burnout early in my career. We will also review where I plan to lead future topics and my goals with this podcast. Finally, I will give you some action steps. I will let you know how to engage on social media and encourage you to share what has been challenging for you thus far in your career with regards to your wellness. I will also provide space for you to let me know what resonates with you and what you want to hear about. Finally, I will leave you with a takeaway for how you can take that next step forward toward wellness in your own life. Before we dive in, let's hear about today's sponsor. Disability insurance is complicated. Doctors shouldn't have to take time to sort through a bunch of insurance quotes to find the best policy. Don't stress over insurance shopping. Let Pattern find the best coverage for you at the most affordable price by visiting patternlife.com/MedEdWell. The link will also be in the show notes. As an additional disclaimer, while everyone's situation is different, and this podcast is not specific financial advice, but rather for your education and entertainment only, disability insurance is for those of you with an income to protect, and typically not for those of you in medical school. All right, now back to today's show. My story begins as I graduated pediatrics residency in 2016. Fresh out of residency, I take off 3 weeks and go on an amazing vacation with my wife. We traveled through Utah, hitting Arches, Canyonlands, Zion, Bryce, the Grand Canyon, a night in Vegas, back through Colorado to Rocky Mountain National Park. We saw some family before finally getting home and jumping right into my first clinic job as a general pediatrician. It was the same clinic system as my residency continuity clinic, so I already knew a lot of the processes. I had great mentors, prior faculty that were now colleagues. I was excited, more than a little nervous, and yet things started pretty well. I ramped up my clinical volumes pretty quickly, pushing myself to full clinical volumes within about 4 months of starting. I passed my boards, transitioned medical record systems within my hospital system, and I even exceeded my RVU goal for the first 6 months. Wait, they incentivize exceeding expectations? Sweet. I'm full-time, 9 sessions per week with 1 session of admin time. I've got this. Things are going great. And yet, as I got into that first winter, things began to catch up with me. Being so early in my career, I was still developing many of my scripts for both interviewing and counseling on particular problems and diagnoses. I was still figuring out charting in real time. How could I get my notes done and efficiently, and yet keep the clinical flow going? Patient orders, paperwork, getting everything done in the course of the day. I found the flow to be very different than in residency. There I would come in, pre-round on my patients in the hospital, work on notes while waiting for the attending, round, go to noon conference and get educational time, see my colleagues, get lunch at the same time, and even on busy months, there was often still a little downtime in the afternoon. Outpatient attending life, though, was a whole different ballgame. Though I didn't have in-house call or 28-hour overnight call, the pressures of 15-minute appointments all day long, different languages, complicated situations that just didn't fit in the 15-minute slots, I barely had time to eat lunch before starting an afternoon of the same. and barely any of my notes done at the end of a session either. So more and more notes coming home, charting in the evening, the next day, on the weekend. My margin was rapidly eroding, and my ability to adequately recharge was clearly being overwhelmed. I'm an introvert at heart. I love my patients, I love the diversity of my clinic, but especially speaking in a foreign language, using phone and video interpreters, the increasing complexity, quality measures, the push to go faster, all these things. It's a huge load, especially a cognitive load. And then the extra notes to bring home, documentation, a push to finish them in 48 to 72 hours. Sooner, maybe even the same day if you can. Midway through my first year as an attending, I was asked to cover a week of newborn nursery and decided to go for it. So naive was I, however, that I worked Monday through Wednesday, covered 7 days of nursery, and then worked Thursday, Friday. No additional day off, no nothing. Yeah, I know it's not trauma call. It's not Q4 call and peds ICU like I did in residency. But at the time, it turned out to be the final straw. One night a few weeks later, my wife and I were sitting on the couch, and I was exhausted. It had become an ongoing thing, this exhaustion, and she said to me, "Something has to change." We knew that our faith and our marriage were more important than my job, and I think I had taken a standardized burnout questionnaire by that point, confirming what I already knew. I was burned out. Great. So now I'm burned out. What had to change? Enter my annual review. One of the leaders in my department was doing my review, and upon finding out what I was going through, she said, "We'll talk about the academic stuff later. We need to figure out a plan for you. You need to physically not be in clinic 1 day a week." I had previously wanted to decrease multiple afternoons by a few patients each day, looking to get out of there closer to on time. But she convinced me that the time would just get filled up even if I had fewer patients. This turned out to be such wise advice, and I am so thankful. I was fortunate to have physician leadership in our large medical group, and they were supportive of me cutting back my clinical time due to my burnout. Around that time, I also went and did specific training with my electronic medical record to get an additional certification. It would allow me to help build things in that environment as a physician and offer more specific input. It was something that was intriguing to me, clinically relevant, and yet another opportunity to diversify my skills and my time. That first year, I cut to 8 sessions, and eventually 7 as I got some protected time to help with system initiatives around the electronic medical record, having received that certification during my 2 off-site trainings. Now my admin time is paired with my half day of reduced FTE, and I ended up at 0.85, still full-time for benefits and student loan eligibility, but I work now closer to 40 hours per week. My wife and I had maintained the financial flexibility to do that by, quote, living like a resident, as Jim Dahlia over at the White Coat Investor would say. We had not maxed out our budget and still had some financial margin to make that change. Regardless of income, this means evaluating needs and wants against priorities. More to come in future episodes about things I have learned along the way that have been helpful with the financial wellness piece, but this was part of me being able to make the professional changes that needed to happen for my personal wellness. The days I have in clinic are still long and stressful sometimes, but 3 consecutive days not in clinic, including the weekend, has made such a big difference. And yet I still struggle with managing my time and energy at work, when to spend a few extra minutes in the room, when to add on that sibling rather than making them come back another day, getting more of my notes or paperwork done versus connecting with colleagues and hearing about their day, how their family is doing. There is always tension in balancing competing priorities, caring for others at work, caring for my family, for friends and others in the community, and caring for myself. Overall, I still love pediatrics. I love my patients and families, the opportunity to make a difference in their lives. It is an intellectually stimulating profession, and I am thankful for this privilege. And yet, work is hard. Each profession and job have their own challenges, but part of life is acknowledging that, and then saying, okay, what capacity do I have to do my work? My capacity doesn't have to look like that of a particular colleague that may have specific reasons for picking up all those extra shifts. I am an introvert, so after a day of talking to patients, coming home and engaging with my family and spending time with them, then at some point I try to get a little downtime. Read a book, listen to music, play the piano, maybe watch some sports or a show with my wife. But then, when do each of us have to push beyond our typical limits? It may be when you're short-staffed at work, when there's an illness in your family, or you're a parent and your child needs more of you in this season. And then, what restorative or rejuvenating habits do I need to cultivate? Either continuing current activities or practices, or developing new ones. Is this exercise, reading a book, mindfulness, spiritual practices, regular connecting with friends? So that begins to scratch the surface of the inputs and outputs of energy, effort, and time facing each of us in the same 24 hours we are given to invest. Looking at your core priorities will definitely affect your personal, professional, and financial wellness, how you respond to things that come up, and how you proactively plan and make decisions. Certainly, personal mindset affects wellness and how you respond to some of the things that you may or may not think you are able to change. Previously, I would have only said may or may not be able to change, but after doing some mindset work myself, I saw that it often comes down to priorities, and whether you say, I can't leave this job, or I can't try to ask for that change at work because what if they say no? Maybe my priority on family says location matters more, so I think that I'm stuck in this job when maybe I could apply with another group across town, even if that takes 6 to 12 months, or I have to change something else about my typical work situation. So again, personal mindset and priorities matter a lot. And yet, there are systems issues at play that greatly affect wellness as well. Just because some physicians actually like their electronic medical record, and I'm one of them, physician researcher Tate Shanafelt and his team found that those same physicians who use an EMR are still more likely to experience burnout. Then there are also the feelings of being unable to do what you know needs to happen for your patient because of policies, prior authorizations, lack of staff, lack of personal protective equipment, any number of things that can be systems issues. And they are not remedied by just using personal wellness strategies, mindfulness, nor resiliency training. These difficult experiences can lead to moral injury, as you aren't able to do what you know you should be doing, or you're stuck doing things such as making life or death triage decisions that you otherwise wouldn't if resources weren't as limited. Or making decisions about appropriate clinical care that you know will decrease patient satisfaction scores, even though it may be the right thing to do. Many of these things need to be addressed at the level of institutions, health departments, or even nationally, and involve many of us coming together to advocate for and be a part of the change that is needed. In the midst of these difficult times with both individual and system stressors, each of us would benefit from a colleague coming alongside us, really asking, how are you doing? And then taking the time to really listen. Do that for one of your colleagues today. It may mean that you help connect one of them with your employee assistance program, or make debriefing as a team more of a thing if you're one of the leaders, whether after a difficult event or at regular team meetings. And each of us is a leader, so speak up and come together and take that time to listen. As you've heard a bit of my story and journey with wellness, I want you to take a step back and look at your own life today. What are the core priorities that drive you, that motivate you to go to work and live your life? How do you feel about your current work situation? Do you think you might be a little burned out? Or a lot? Don't stay in the shame and the negative self-talk. Reach out and ask for help, whether that's making a change in your schedule, seeing a counselor through your employee assistance program. Could be something else, just having coffee with a colleague. What is one thing that you could change today in your mindset and how could that improve your wellness at work in the next month? Again, take a moment and reflect on your core priorities, where you are with your wellness, and what small change you are going to make to impact your wellness starting today. Thank you so much for joining me today for this, the first episode of the MedEdWell Podcast. Again, this episode is made possible in part by Pattern. For those of you with an income to protect, get a disability insurance quote today at patternlife.com/MedEdWell. If you found this episode valuable, please subscribe to the podcast, share with another physician, and share it on social media. You can find me on Instagram and follow MedEdWell there. If you have feedback, there is a contact form on the website. Otherwise, if you loved it, please leave a review. It'll help get the word out to other doctors who are looking for this kind of discussion about wellness and medicine. Have a wonderful day, and I hope to see you all back for the next episode of the MedEdWell Podcast. And now for our important disclaimer. Dr. Ryan Stegink is a practicing general pediatrician, but the MedEdWell Podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEdWell Podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEdWell Podcast, and have a great day.